Hello, shareholders, potential investors, and key stakeholders. I am Dawn Bitz, CEO of Adherium, and I'm excited to share an update with you today. Just acknowledging there are forward-looking statements outlined in this presentation, so use those statements at your discretion. From an executive summary standpoint, Adherium continues to achieve substantial milestones in its new course as a respiratory digital health and monitoring company. We continue to address major clinical needs using our respiratory management platform, driving industry-leading medication adherence. We are building a strong commercial momentum led today by a remote patient monitoring channel, which continues to be fueled by positive developments in the reimbursement codes in the United States. And all of that accumulates into growth and patient utilization, all of which I'm going to point out and go through in more detail today in this story. Starting off, about 40 million Americans today fight chronic respiratory disease. This becomes a very catastrophic disease for both their clinical as well as the healthcare system's economic opportunities. So what constitutes that respiratory disease? It really falls generally into two buckets. First, chronic obstructive pulmonary disease, or COPD. This is the grandmother that you see walking down the street having oxygen. This is chronic bronchitis, emphysema, smoker's cough. This again is a catastrophic respiratory disease that many people live with. Also under this category is asthma. Asthma can start, of course, in childhood, but then can also progress into adult and become chronic and something that affects people's lives on a day-to-day basis. One of the things about both of these diseases under, again, this moniker of respiratory disease in general, is that the pharmaceutical companies have done a very good job in creating medications that can help not only treat these diseases whenever they have an attack, but also help manage these diseases over the patient's life cycle. However, the challenge is just in general human nature. We tend to have very low compliance on medication utilization, particularly if we have to take it over a long period of time. And the literature is very strong in stating that about 20% of adherence is very average for patients who suffer from respiratory disease. So just keep that in mind. If you think about these patients who might need to take a medication twice a day for 7 days a week, the general statistic is that they're only doing it about 20% of the time. This then translates into not only increased and very high costs of treatment for these kinds of patients. In the US alone, that's about $120 billion in direct costs to the US healthcare system when we combine both asthma costs and COPD costs. However, those are very large numbers, 40 million patients, $120 billion US dollars worth of costs. But for you as potential investors and key stakeholders and shareholders into the organization, what does that mean actually to Adherium? So we've actually done the work to really think through how do we define not only our total available market, but really the served available market, the market that we can really affect sooner than later on tomorrow, so to speak. So we really whittled that down to our target market. Our served market is really about 14 million patients. And that really is a market opportunity for Adherium specifically of about $13 billion. And those are US dollars when I'm quoting that. Now, going back, if we can improve that 20% adherence, what's the right threshold we need to achieve in order to drive really a reduction in hospitalizations as well as costs? And the literature proves that out for us. That target is about 60% adherence. For patients who achieve about a 60% adherence, that's been correlated to about a 50% reduction in costs and 50% reduction in hospitalizations. That's our target threshold. How does Adherium's product offering drive adherence? Well, first, it starts with our Haley Smart Inhalers. This is really the digital engine. It really ties to the entire ecosystem of Adherium's product offering. First, it starts with our Haley Smart Inhalers. These are the jackets that fit onto the medications and that are outfitted with sensors that create a tremendous amount of data that allows us to see how that patient is doing on a daily basis in between their doctor's visits. So we can monitor that data and be able to then act upon that data. Pairing that data and putting it into our tech stack platform, our Haley Care platform, that then becomes the interface for the patients to see how they're doing, for their providers to monitor the patients, for us to be able to help manage the patients on behalf of their providers, and of course, the opportunity for us to extract data out of it to do ongoing data analytics. We round that out with an entire respiratory care team and patient engagement tools, and this then becomes our entire closed loop respiratory management ecosystem product offering, all designed and oriented to be able to improve not only the adherence, but also the patient lives. Now, how do we monetize that ecosystem? And where we've landed today is we're generating recurring revenue through today our remote patient monitoring, but very near future through value-based care contracts. So let's start with our remote patient monitoring, our RPM business model. So our RPM business model is a fee-for-service business model that today we receive about $55 per patient per month. This has been the foundation of the revenue growth that we've been demonstrating over the last 6 months. The learnings, the competencies, and the infrastructure that we're building today, utilizing the RPM model, is then a direct translation into opening up the next big opportunity for us, which are value-based care contracts, direct contracts with the U.S. insurance providers to, again, continue to build upon and exponentially drive additional recurring revenue for Adherium. Now, if that's our mission, how do we begin taking the steps towards achieving that mission and driving that recurring revenue? Well, first and foremost, we wanted to define 3 value creation milestones. The first one, generating compelling data that continues to demonstrate the Haley Smart Inhalers, that entire closed loop ecosystem that we've created actually can be translated into not only increased adherence, but also cost reductions, improvement in hospitalizations, emergency department visits, and ongoing clinical outcomes. The second big value creation milestone was establishing the infrastructure internal to Adherium to be able to support not only our RPM business and drive the revenue, but also set the stage for our ability to execute against value-based contracts. And then finally, we needed to demonstrate our ability to scale and our ability to get these patients onto our RPM opportunity, our RPM program, continue to build that momentum and ultimately achieve a patient volume that was meaningful, not only to you, our investors, but also to the payers and providers and partners for our future. So looking more closely at creation of compelling data sets, this really started with a relationship with Intermountain Health. A couple of years ago, we collaborated with Intermountain Health to be able to lean into and provide our Haley Smart Inhalers for their eye care study. The eye care study was actually designed as a quality improvement study. That quality improvement study was really looking at how did they increase their own very high standard, very high benchmark on the care of their respiratory patients and elevate that even further. And they believed the Haley Smart Inhalers would be able to do that, and they put that into a quality improvement study. But really behind that quality improvement study is really an all-comers real world study, and their target was to make this study the largest study on adherence it has ever been conducted. In comparison, typical studies on adherence typically range about 20 to maybe 30 patients. The biggest ones tend to be maybe in the 100 patient mark. This study, upon its completion, targeted for May of this calendar year, they're targeting upwards of 1,500 to 2,000 patients. Intermountain Health undertook an interim analysis back in August of the data. And the exciting thing is at the time, there were 850 patients. At that point, this has now become the largest real-world adherence study to date in the world at 850 patients. The results, as you can see here, when we look at that baseline of adherence for both asthma and COPD, it's in about the 20% mark. When we compare that to the adherence results coming out of the eye care study, not only did we achieve that 60% threshold, we overachieved that with a 64% adherence for asthma and 67% adherence for COPD. This means there was about a 235% increase in adherence across both of those diseases. And what that means is when we bring that back to the literature, we look at that meeting that benchmark that can drive 50% reduction of costs and hospitalizations, we're now in the sweet spot. And even moreover, you look at about a third of the patients, about a third of those 850 patients actually achieved an adherence of 80%. This is unheard of in the respiratory community. Now, this is just the tip of the iceberg. Adherence, as it's been publicly relayed, is just, again, one aspect of the data set that's coming out of this eye care study. And I'm excited to report that not only is hospitalization reductions, emergency department reductions, and cost reductions contained in the data set, but that package with the adherence data has been put together into an abstract. That abstract has been submitted to the world's largest respiratory conference, the American Thoracic Society Conference, the most important global respiratory conference in existence. And that abstract has been accepted not only for publication, but also for presentation. That conference is occurring in May, mid-May, May 15th to the 20th in the United States. And we will be very excited to see the results and then ultimately share those results, again, on cost reductions and hospitalization reductions in the very near future. So when we take that cost savings data, we continue to work with Intermountain Health to continue to get that data out and get it public and be able to make it useful. We continue to be fueled by the fact that we know not only does the Haley Smart Inhaler technology and our entire ecosystem improve adherence, but we are confident that it reduces costs and improves all of the other clinical outcomes, including hospitalizations. So when we continue to lean into our value creation milestones, the next major milestone that, again, we are continuing to build out is this infrastructure, and again, the recurring revenue. At Adherium, we've done, I believe, a very good job in getting contracts with key partners. We'll continue to expand those partnerships with additional partners moving forward. But really, how do we continue to maximize the partnerships that we have at hand? And today, if I particularly focus in on the partnerships that drive our recurring revenue model, our RPM model today, those are our partnerships with Allergy Partners, CIIC, and CENTA. Let me drill into our Allergy Partners relationship because I think this is, again, a hallmark of what we continue to do here at Adherium as we continue to build this business and build recurring revenue opportunities. So Allergy Partners, an important partnership for us, collaboration for us. You probably heard, or if you haven't, take a look at the webinar that we did with the CEO of Allergy Partners, Dr. Bill McCann, back towards the end of the calendar year last year. And you can hear his passion for what this program is doing, not only for his business, but also for his patients. And when you look at the breadth of Allergy Partners, these are medical clinics across the United States. There's about 110 of them, and they specifically specialize in the treatment of allergies, but also asthma. There's, of that 110 clinics across the US, we've actually activated about 80% of those clinics. And what does that mean for us and for you as investors into Adherium? Well, first off, when we actually activate one of the clinics under Allergy Partners, that then enables them to provide us the list of all of their patients. We then take that list, we run it through some internal mechanisms where we look at the patient's eligibility as well as whether or not their insurance actually covers and reimburses our program. Once we've scrubbed that list, those patients then can go into our internal processes within Adherium to ultimately join and be a part of our program. And every patient that joins that program is monetizable for us. But before I get into the details of that, I want to share with you that at this point, we have about 63,000 insurance verified patients that are going into our funnel today. And today, for us, for scaling purposes, it's about how quickly we can get those patients and work through those 63,000 patients at the top of our funnel. So what we've done since August is we stood up our own internal call center that actually takes that list, reaches out to the patients, explains the program to them, gets their consent, and then once they've got consent, we ship them a device. And at that point in time, we then work with the patients to get them onboarded into the program. And then, of course, on a monthly basis, interacting with our care team. At the point of onboarding and the monthly interaction with our care team, that patient then can generate $55 per patient per month in recurring revenue. So let's look at what that's done in a very short period of time. This entire program, again, stood up in earnest in August of 2025. At that point in time, or prior to that point in time, we had about 351 shipments to patients of our devices. From August on through December, we grew that shipment total to over 2,100 shipments to patients eligible in our program. That's our leading indicator, but how does that translate into revenue? And as you can see here, it translates not only into revenue, but growing revenue. And this is recurring revenue. This revenue is growing about 20% month over month. And that trajectory continues that we expect, again, will continue to deliver recurring revenue into 2026 and beyond. So I've talked to you about the data sets and how the data sets continue to evolve and again continue to create jaw-dropping moments for our key opinion leaders, our patients, and other providers in the space. I've described how we continue to lean in and build the infrastructure to support recurring revenue, but how do we get to and when can we get to more critical mass that it becomes meaningful for us as an organization? So we take the momentum that we started in, again, August of 2025. At the end of December 2026, again, over 2,100 shipments. That continues to put us onto a target and a target of about 10,000 patients by the end of the calendar year 2026. Midway, we're expecting about 5,000, 5,500 patients or so. Again, those are our targets. That's what we're working towards achieving. And again, we continue to build that. We continue to build credibility in the amount of patients that we have on our program that becomes very meaningful. And why is that meaningful? As you heard earlier, I talked about the RPM business as our stepping stone to a higher opportunity, higher value opportunity in value-based contracts. This is where we get a contract directly now with the insurance providers, and they can, again, see value in that contract. We help them reduce costs, reduce risks, and improve their patients. That is meaningful to them. They will pay for that. So again, how do each one of these three value milestones align? Well, we create the argument for cost savings for the payers. We demonstrate that we have the infrastructure to fulfill the contract. And again, we give them confidence that we've got enough patients in our program that they give us their patients, we can then fulfill those contracts. So again, today, the fee-for-service RPM opportunity in delivering the current recurring revenue today is really the building block, the stepping stone into the larger opportunity on value-based care. So when we compare our RPM opportunity to our value-based care side by side, again, RPM meaningful today. We continue to build that side of our business, and we will continue to grow that side of our business going forward. However, it really, again, is the springboard into this larger opportunity. Higher price point, higher margin, larger contract, greater number of patients, and the key piece is that we get to manage by exception. And so it's a per patient, per month fee, no matter how many patients are on that contract. So again, exciting times, very large opportunity, and this is where we get to grow Adherium later in 2026, 2027, and beyond through these value-based care contracts. So I want to just give you a couple of examples of what these contracts could mean to Adherium. This is not an example of an existing contract, but this just gives you the insight into what we're working to achieve and why these value-based care contracts are so important for us to get into, to be able to not only drive the access to our technology, but also, again, the opportunity and the revenue for the organization. So if we take one of the smaller contract opportunities, this is with Select Health. Select Health is a key payer because they actually are tied to Intermountain Health, again, our collaborator for the eye care study. So Select Health is a smaller insurance provider with about 1.1 US members underneath that payer program. So if we took just a small fraction of their COPD patients in this example, again, somewhere between 5% or 10%, which really could constitute their severe COPD patients. And we were able to, again, put them into a program where we could continue to demonstrate, again, reduction of costs and reduction of hospitalizations. This could translate into a reduction of roughly $30 million to $60 million in costs for Select Health. that could mean a contract valued at roughly between 3 million and 6 million US dollars for Adherium, which is pretty good, and we're excited about that. However, we also know that that is, again, a gateway into larger contracts. A larger contract could be a contract with an entity like Cigna, where Cigna has 17 million US members underneath that insurance program. Again, taking a much smaller percentage, COPD patients, maybe those severe patients, again, 5 to 10%. Now we talk about a cost reduction opportunity for Cigna, saving them somewhere between potentially $500 million and $1 billion. This contract, or a contract of this type, could be worth somewhere between $44 million and $88 million US. Now, why did we select Cigna? Because we have ongoing conversations with Cigna as we speak. Our goal for really 2026 internally is we'd like to achieve some of these smaller contracts here towards the end of this calendar year, setting the stage for larger contracts like this in 2027 and beyond. And again, when we look at analogs in this entire medical digital healthcare space with value-based care contracts, there's an entity called Omada Health. Omada Health essentially did similar things to what we're doing, starting with RPM, leveraging that into value-based care contracts. They recently went public last calendar year in the US space. They did their IPO at about a $1.1 billion valuation. What drove that is a couple of these key contracts under a value-based care moniker. So for us, when we look at the overall business and being very focused on execution and operationalization today with a very commercial intent, number one, we continue to work with not only Intermountain Health, but future collaborators as well to continue to drive compelling data that demonstrates that not only can our Haley Smart Inhalers and our entire closed loop respiratory ecosystem drive improvement in adherence, but also cost reduction. Very, very meaningful for the payers. Number two, we continue to build out and scale and using our capital dollars more efficiently and more consortedly into driving commercialization. Build the infrastructure, continue to drive recurring revenue through our RPM model, setting the stage to be able to execute these larger contracts. And then, of course, continuing to scale our patient volume to be able to demonstrate the credibility to these payers, to really begin opening the doors with these payers on a smaller scale, latter part of 2026, and then, of course, increasing the scale of those contracts 2027 and beyond. I'm happy to report that we continue to assemble a top-notch team with experience in this space to be able to demonstrate and deliver this commercial opportunity. I'm also excited at the fact that our key shareholders, including many of you on the phone, continue to believe in the story, continue to double down in the story, including strategics like Trudell Medical, that continue to build the foundation and the capital that we need to continue to deliver upon the company's vision and, of course, the value to you as shareholders and, of course, potential investors. And I'm very excited to be sitting in front of you again, thanking you for your time today as key shareholders, potential investors, and stakeholders in Adherium as we continue to operationalize this business, be commercially focused on execution, and of course, delivering to you an opportunity for growth and for value. Thank you very much.